I'll just introduce the topic. Corneal perforations remains one of the most devastating complication of corneal disorders, and there are several terminologies which have been applied to denote the corneal perforation, but management remains almost the same. These are some of the etiologies of the corneal perforations, mostly infective, then non-infective also, dry eye, chemical injuries, and neurotrophic conditions. All disorders which causes the tissue loss or collagenolisis, they cause corneal thinning or stromal loss, and then finally corneal perforations. Believe me, the corneal perforation is the most underdiagnosed condition. These are some of the clinical entities where you can suspect the perforation, but the most important sign is that you have a perforation and iris is presenting. That means there is a sure that the corneal perforation is there. Of course, the Seidel test remains the gold standard to diagnose perforation in the patients who have AC formed or hypotony. You do Seidel test and the corneal perforation will be there. We need to work up all these cases. If you have an infective etiology, do all these microbiological workup, and if you have non-infective, then go for the collagen workup. These are some of the cases where you have collagen disorders underlying. This is one patient who had a Murans ulcer, very large perforation, and finally managed with DLK. So such large perforations with corneal infection, we need therapeutic penetrating keratoplasty straight away. Medical treatment alone will not do it. And corneal perforations, we have treatment options like tissue adhesives, therapeutic PK, DLK, conjunctival graft. All these topics will be covered. And we need to be very cautious when we are doing certain things like conjunctival flap. The patient should not have very active infection, or tarsorrhaphy. Then also the infection should be either under control, or there should not be frank infection, because it will be difficult to manage once we do that. So we know all that there are sequelae to the corneal perforations: retinal detachment, choroidal detachment, exclusion of lens, vitreous, endophthalmitis. So this is a devastating condition. We have to act very early to prevent the disasters and to prevent the blindness. So I would like to say that you should have high index of suspicion for corneal perforation, and clinical diagnosis of you have to confirm it, and